Hello friends! We have covered oral reflexes in a video before, and today I'm going to talk about oral reflex integration therapy so that these exercises can help your child in actions like biting, chewing and swallowing independently. Chewing action in a child can get delayed because of swallowing reflex, tongue reflex, transverse tongue reflex or even bite reflex. So we are going to do different activities or different exercises that are going to help with the chewing of the child. The first step is get your child into a habit of biting food. In order to introduce biting, use the T part of the tube and ask the child to hold it between the teeth. Hmm, 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 hmm. And ask the child to open their mouth completely so that you can pull it out gently rather than pulling it out forcefully. If the child has an active bite reflex, it is important that you also practice holding the chewy tube between the lips so that the bite reflex is not stimulated. So you keep it here. Hmm, 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 hmm. And let the child open the lips so that you can pull out the tube gently. These exercises can also help in stimulating lip closure in a child. The next part that you're going to do is tongue lateralization, making it more voluntary, because once the food is introduced or bitten, it has to be taken by the tongue towards the side for chewing before it is swallowed reflexively or voluntarily. Keep the chewy tube stem in the center. 1, 2, 3, 4. So like this, the child has to push the chewy tube on either side with their tongue. In order to stimulate it further, you can also ask the child to touch their tongue to the angles of the mouth. Let's start. Huh, 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 huh. So like this, 10 times on each side we can practice. Later on, the same action can be done inside the cheeks also, because while you do the chewing action, the tongue moves the food inside the mouth with the lips closed. So in order to do that, you can show them, I am placing my finger on your cheek. Can you try to touch your tongue over here from inside your mouth? Try again. Very good. Let's try on the other side. Let's try again. Very good. So every time they get closer to your finger, you realize that they are gaining control of their tongue. Then we are going to stimulate the chewing action in the child, which is again using the knobbly stem of the chewy tube, placing it towards the side between the premolars and molars. Hmm, hmm. Practice it on both sides. As an adult habit also, we are usually used to chewing on one side. So get them to practice on both sides because the chewing action should be more uniform. And later on, leave the chewy tube in their mouth so that it stimulates or simulates more of a chewing action. And later on, this can be replaced with a solid food item like carrots or cucumbers so that they can try to chew on it and understand how the action needs to be performed. If you're introducing the food with spoon, try to give it towards the side so that the child gets to chew it, because the biting action is not going to be there then. For further stimulating swallowing, it is important that you give cup for drinking liquids as soon as possible to the child, because with straw or spoon the liquid quantity is always controlled. But with a cup, initially the child will take one sip at a time, and later on they will learn to control it, and even if the cup is on their lips all the time, they are going to take one sip and keep on swallowing voluntarily. I hope these reflex integration activities were helpful for you. If they were, please mention it in the comments below along with any queries or suggestions that you might have. Also like the video, subscribe to the channel for more videos related to child development and reflex integration therapy. Ring the bell icon for notifications when my videos are out, and we'll meet again soon. Bye.